Did you know that some of the pills you might have in your medicine cabinet right now could be silently leading you towards a heart attack? Yes, you heard that right. Today, we uncover the terrifying truth about common medications that could put your heart at risk. This information could save your life or the life of someone you love, so stay tuned. Hey everyone, welcome back to our channel where we dive deep into the issues that really matter. If you're new here, don't forget to hit that subscribe button and click the bell icon so you never miss an update. Today's topic is a real eye-opener. We're talking about 9 common medications that could potentially lead to a heart attack. So, grab a seat, maybe a notepad, because you won't want to miss this. Let's get into it. And if you find this video helpful, please give it a thumbs up and share it with your friends and family. Your support helps us create more content that matters. Medications are a vital part of modern healthcare, helping millions manage and overcome various health conditions. But, not all medications are without risk. Even those prescribed by your doctor can have dangerous side effects if not monitored properly. Heart attacks are a leading cause of death worldwide, and while factors like diet, exercise, and genetics play significant roles, certain medications can also increase your risk. Heart attacks occur when blood flow to the heart is blocked, often by a buildup of fat, cholesterol, and other substances. When these substances form plaque in the arteries that feed the heart, it can lead to a heart attack. Medications can influence this process in various ways, from increasing cholesterol levels to affecting blood pressure and heart rhythms. It's crucial to understand that while these medications can be life-saving, they must be used correctly and under strict medical supervision. Here's a look at the top 9 common medications that you need to be aware of. Before we dive into the details, a quick disclaimer. This video is for informational purposes only. It's not intended to replace professional medical advice, diagnosis, or treatment. Always consult your doctor or a qualified health provider with any questions you may have regarding your medications or medical conditions. Alright friends, let's break down the list of medications that could pose a risk to your heart health. 1. Nonsteroidal anti-inflammatory drugs, NSAIDs. First up, we have nonsteroidal anti-inflammatory drugs, or NSAIDs, which include familiar names like ibuprofen, Advil, Motrin, and naproxen, Aleve. These medications are widely used to treat pain, inflammation, and fever. While they are effective and commonly available over the counter, there's a darker side to them. Prolonged or excessive use of NSAIDs can increase your risk of heart attack and stroke. These drugs work by inhibiting enzymes called COX-1 and COX-2, which play a role in inflammation. However, this inhibition can also lead to an imbalance in the body's natural process of clotting and blood flow. For instance, long-term use of high doses can lead to the stiffening of arteries and increased blood pressure, creating a perfect storm for heart problems. Always use NSAIDs as directed and consult your doctor if you find yourself needing them frequently. 2. Certain antibiotics, macrolides. Next on our list are certain antibiotics, specifically macrolides, such as azithromycin, commonly known as Z-Pak. These antibiotics are often prescribed for respiratory infections, like bronchitis and pneumonia. While they are generally safe for most people, they have been linked to an increased risk of cardiac events, particularly arrhythmias. Macrolides can cause changes in the electrical activity of the heart, leading to a condition known as QT prolongation. This condition can result in abnormal heart rhythms, which, in severe cases, can escalate to sudden cardiac death. The risk is higher in individuals with existing heart conditions or those who are taking other medications that affect heart rhythm. Always inform your healthcare provider about your full medical history before starting any new antibiotic. 3. Proton pump inhibitors, PPIs. Proton pump inhibitors, or PPIs, like omeprazole, Prilosec, and esomeprazole, Nexium, are widely used to treat acid reflux, GERD, and stomach ulcers by reducing the amount of acid produced in the stomach. However, long-term use of PPIs has been associated with several cardiovascular risks. Studies have suggested that prolonged PPI use can lead to the thickening of the walls of the arteries, a condition known as atherosclerosis, which is a major risk factor for heart attacks. Additionally, PPIs can lead to magnesium deficiency, which is crucial for maintaining a normal heart rhythm. If you're using PPIs for an extended period, it's essential to do so under medical supervision and explore alternative treatments if possible. 4. Corticosteroids. Corticosteroids, such as prednisone, are potent anti-inflammatory medications used to treat a variety of conditions, including asthma, arthritis, and autoimmune diseases. While incredibly effective at reducing inflammation, they can have serious side effects when used long-term or in high doses. One significant risk is the impact on cardiovascular health. Corticosteroids can increase blood pressure, cause fluid retention, and elevate blood sugar levels, all of which contribute to a higher risk of heart disease. Moreover, these medications can lead to an increase in LDL cholesterol, the bad cholesterol, and a decrease in HDL cholesterol, the good cholesterol, promoting plaque buildup in the arteries. If you're on corticosteroids, it's vital to have regular checkups with your doctor to monitor your heart health. 5. Oral contraceptives. Oral contraceptives, particularly those containing estrogen, are widely used for birth control. However, these medications can increase the risk of blood clots, which can travel to the heart or lungs, leading to a heart attack or pulmonary embolism. The risk is especially high for women who smoke, are over the age of 35, or have other risk factors such as a history of blood clots. Estrogen can cause the blood to clot more easily, and combined with progestin, it can lead to changes in blood vessel walls, making them more susceptible to clots. If you're considering oral contraceptives, it's important to discuss your personal and family medical history with your healthcare provider to choose the safest option for you. 6. Diabetes medications, thiazolidinedionase. Thiazolidinedionase, such as rosiglitazone, Avandia, and pioglitazone, Actos, are a class of drugs used to treat type 2 diabetes by improving insulin sensitivity. Despite their benefits, these medications have been associated with an increased risk of heart failure and heart attack. Thiazolidinedionase can cause the body to retain fluid, which can lead to or worsen heart failure, particularly in patients with existing heart conditions. Additionally, some studies have suggested a link between these drugs and an increased risk of heart attacks, although this remains a topic of debate among researchers. If you are taking thiazolidinedionase, it's crucial to monitor for any signs of heart problems and have regular consultations with your healthcare provider. 7. ADHD medications. Medications used to treat attention deficit hyperactivity disorder, ADHD, such as stimulants like Adderall, amphetamine, and Ritalin, methylphenidate, are effective for improving focus and reducing hyperactivity. However, these medications can have significant cardiovascular effects. Stimulants work by increasing the levels of certain neurotransmitters in the brain, which can also lead to an increase in heart rate and blood pressure. For individuals with underlying heart conditions or those who are undiagnosed, this can elevate the risk of heart attack and other cardiovascular events. It's important for anyone prescribed ADHD medications to have their heart health monitored regularly, especially during the initial stages of treatment. 8. Antidepressants, SSRIs. Selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, Prozac, and sertraline, Zoloft, are commonly prescribed for depression and anxiety disorders. While they are generally safe and effective, SSRIs can increase the risk of bleeding, particularly in the gastrointestinal tract, which can be problematic for individuals with heart conditions. Additionally, some studies have suggested that SSRIs might influence heart rhythm and contribute to QT prolongation, though this risk is relatively low. If you're taking SSRIs, it's important to have regular consultations with your healthcare provider and discuss any potential side effects, especially if you have a history of heart disease. 9. Antipsychotic drugs. Finally, we have antipsychotic drugs, such as olanzapine, Zyprexa, and risperidone, Risperdal, used to treat severe mental health conditions like schizophrenia and bipolar disorder. These medications can lead to significant weight gain, diabetes, and high cholesterol, all of which are major risk factors for heart disease. Moreover, some antipsychotics can affect heart rhythm, leading to conditions like arrhythmias, which increase the risk of heart attack. If you or a loved one are taking antipsychotic medications, it's crucial to maintain a healthy lifestyle, monitor your weight, blood sugar, and cholesterol levels, and have regular checkups with your healthcare provider. So, there you have it. While these medications are essential for treating various conditions, it's crucial to be aware of their potential risks. Always discuss any concerns with your healthcare provider and never stop taking a prescribed medication without consulting them first. If you found this video insightful, please give it a thumbs up, share it with your loved ones, and leave a comment below if you have any questions or experiences you'd like to share. Don't forget to subscribe and click the bell icon so you're notified every time we post new content. Stay informed, stay safe, and take care of your heart. Thanks for watching. Until next time, take care of your health and each other.